What is the role of a physiotherapist? A physiotherapist is a healthcare professional who is trained to evaluate and treat various physical conditions that affect the body's movement and function. They use evidence-based techniques to help their patients recover from injury, illness, or disability. What are the benefits of physiotherapy? Pain relief. Physiotherapy can help alleviate pain and discomfort associated with various conditions, such as back pain, neck pain, arthritis, and fibromyalgia. Improved mobility. Physiotherapy can help improve your mobility, flexibility, and range of motion, which can help you perform daily activities more easily. Faster recovery. Physiotherapy can help speed up your recovery from injury, surgery, or illness by promoting healing and preventing complications. Prevention of future injuries. Physiotherapy can help prevent future injuries by identifying and addressing underlying issues that may contribute to them. What are some common conditions treated with physiotherapy? Back pain. Physiotherapy can help relieve pain and improve function in people with back pain. Techniques used may include exercise, manual therapy, and education on proper posture and body mechanics. Stroke. Physiotherapy can help people recover from stroke by improving their mobility, strength, and balance. Sports injuries. Physiotherapy can help athletes recover from injuries and prevent future ones by identifying and addressing underlying issues that may contribute to them. Arthritis. Physiotherapy can help people with arthritis manage their pain and improve their mobility and function. Respiratory conditions. Physiotherapy can help people with respiratory conditions, such as chronic obstructive pulmonary disease (COPD), improve their breathing and lung function. What techniques are used in physiotherapy? Exercise. Physiotherapists may prescribe specific exercises to help improve strength, flexibility, and range of motion. Manual therapy. Physiotherapists may use hands-on techniques, such as massage and manipulation, to help improve joint mobility and reduce pain. Education. Physiotherapists may provide education on proper posture, body mechanics, and ergonomics to help prevent injury and improve function. Modalities. Physiotherapists may use various modalities, such as ultrasound, heat, and ice, to help reduce pain and inflammation.